Welcome to this training. My name is Dr. Kasia Kainz, and I am the CEO and founder of EBV Global Institute. And today is a great training for you. Super excited to share. It's about one of the most common co-infections, H. pylori, if you have chronic EBV. The good thing is that over the 20 years in my clinical practice, I have worked with H. pylori a lot. I've helped a lot of people, and that goes all the way back, way before my work with EBV. And it helps me support my EBV community right now because, like I said, it's a common co-infection. So we're going to walk through some of the things that I need you to understand in case you are struggling with it. And the good thing is that I created an entire blog with medical references and details and more expansive. So under this video, there will be a link to this blog. It is also easy to find. Just go to ebvhelp.com and go under blogs, and it's going to be right there. So let's get started. Helicobacter pylori. It's a gram-negative bacterium that lives in your stomach lining. Mostly, but not only. And I have a couple of surprises for you about that. Well, the last study that I've seen recently about EBV stated that 98% of global population carries EBV. I thought it was about 95, and now it's 98. With H. pylori, it's about 50%. Just like with EBV, doesn't mean that everybody gets sick, but there are certain situations when you would. And it can be life-threatening, it can cause cancer, it can cause autoimmunity. So I actually am finding that H. pylori and EBV, carry similar, in different ways, but carry similar risk and similar gravity of risks and a lot of autoimmunity cancers, very interesting. And of all the co-infections that I see in our EBV community, H. pylori and SIBO are the two big ones, honestly. And I think H. pylori is probably more common. So it's really important to understand it. There's a concept in medical literature that I want to explain first called transactivation in terms of EBV and other infections that are unrelated. And the way it works is that basically it goes both ways. Either you have EBV infection and as a result, you can trigger another co-infection, or you have a co-infection that can trigger EBV. To give you a good example, a very good example of that was COVID epidemic. We had a subclass of EBV population of people who had two situations. People had chronic EBV, and when they contracted COVID, they flared up much more severely with EBV. Or there was a population that did not have EBV, chronic EBV. They contracted COVID, and first time in their life, they developed chronic EBV, severe chronic EBV. Can go, in both ways. So anyway, that's quite common. So it is not uncommon for a person with chronic EBV to unfortunately develop some other co-infections. And also, I want to mention one caveat to that EBV is an opportunist. So if you have an infection, like if you have SIBO infection, it can cause leaky gut. This can cause nutritional deficiencies. This can really compromise your body, your functions. And when you are compromised in any way, this is where EBV likes to do its magic. So that also makes sense in this whole concept of transactivation, doesn't it? Because nutritional deficiencies alone can trigger EBV reactivation. So it's like complete circle. Let's talk about the first area related to H. pylori that is less known, not related to the gastrointestinal tract, and that's autoimmunity. So interestingly, I found a study that it's a meta study. So meta-analysis, when it's a study that looks at all the studies on a particular topic and evaluates them. And so this study looked at all the autoimmune conditions related to EBV, not EBV, H. pylori, sorry, that were, that studies were claiming. And they made a list of 95 autoimmune disorders that were either directly caused by H. pylori or associated with H. pylori. In other terms, association means we don't know what causes what, but there's a link. You have this, you have that. And it really parallels EBV, interestingly. And so in my blog, there's a whole list, not a whole list, but there's a list of some of them. And then there's a link to the studies that you can look at the 95. I'm going to mention some of them, but the most important two, and especially one in EBV community, is Hashimoto's thyroiditis. So there are different causative factors of Hashimoto's thyroiditis, okay? But based on my clinical experience and medical literature and what I see, our community, I would say number one, in my book, number one causative factor is straightforward EBV. But number two, it's H. pylori. And so if you have Hashimoto's, you have to evaluate both or either. Otherwise, good luck to you. Hashimoto's is not caused randomly by the body. It's typically an infecting agent. Could also be other infecting agent, but that's more rare. And also gluten can trigger it. But I think like really EBV is number one. And the point is that in our community, people that work with me and have Hashimoto's are able to reverse engineer and get the Hashimoto's in complete remission just focusing on EBV. So, and why I'm talking about Hashimoto's so much is because, let me give you some statistics from studies. About 90% plus of women diagnosed with hypothyroidism actually have Hashimoto's. It's not just low thyroid, it's an autoimmune thyroiditis. However, it is not tested properly, and it's a big issue. So doctors are not testing for Hashimoto's. And you can be on medications for low thyroid for decades, and that's never addressed. At the same time, whether it's H. pylori or EBV, it continues damaging the thyroid. It lives in thyroid. The immune cells are trying to kill that infecting agent. The damage to thyroid continues, and medications are not stopping the cause of it. So it is completely misdiagnosed. So this is something to bring to your attention. I talk about it anytime I can because I have had a lot of women and some men too who are misdiagnosed or undiagnosed properly figure out that they had Hashimoto's. And from there, you know what to do, So EBV would be number one priority. And depending on your symptoms and presentation, you may want to evaluate for H. pylori. H. pylori, yes, I hope it makes sense. So another common one caused by H. pylori that people do not actually know about is rheumatoid arthritis. So the interesting thing is that H. pylori does not only live in your stomach. It's been shown on your teeth, in your mouth, in your esophagus, on your skin, eyes, even ears, liver, bile, gallbladder. I mean, the list goes on and on. Even in the heart muscle, I think they found it. And it makes sense that you have 95 associated autoimmune disorders. I mean, read some of them. Lupus is a big one. Sjogren, systemic sclerosis, multiple sclerosis. That was really surprising to me as well. Autoimmune hepatitis, alopecia areata, fibromyalgia graves, narcolepsy, diabetes type 1, psoriasis. Let me see where else. Periodontal disease, halitosis. There was H. pylori is found on the plaque sometimes in your teeth and also in root canal. That's a different story. As you can see, the gastrointestinal presentation is the one that we are most familiar with. You have gastritis, you have heartburn, you have ulceration in the stomach. That's more of a common presentation, but it can be chronic autoimmunity. So let's talk about the gut issues, because this is most common. Let me look at some of the studies here. I'm just going to read some of them because there's a lot in my blog, so you can, read more. Approximately 70% of population with H. pylori colonization in the stomach is asymptomatic. Out of the 70%, 10 to 20% may develop peptic ulcer, and 1 to 2% gastric cancer or mucosa type lymphoma. So there's duodenal ulcers as well. 90 to 100% of those patients have H. pylori. The risk may increase with age. More than, let me see here. Yeah, so there's a lot of cancer risk. The World Health Organization has listed H. pylori as a carcinogen for gastric cancer. And there was a statement they published as a working group report indicating that eradication of H. pylori should be used as a strategy to prevent gastric cancer. But the caveat is H. pylori's presence is necessary, but not solely sufficient for the full development of cancer, gastric cancer. So you can't just get stomach cancer because you have H. pylori. And there is a particular stool test that I like, GI map by Diagnostic Solutions, that has virology factors. No, these are not virology factors. What is it called? I don't remember. There is a list of factors that are carcinogenic factors for H. pylori that are included in the stool test. So they don't just test for H. pylori presence, but they also test for predisposition to cancer. So this is really important. Okay. Couple of other things that I want to mention is, and this is a big issue. This is a very serious issue. So H. pylori can affect parietal cells in your stomach. Why is that important? Parietal cells are the cells in the stomach that produce stomach acid. Okay. This can ultimately lead to a complete loss of parietal cells. If you have that situation, you will develop atrophic gastritis. And there's also pernicious anemia, similar situation when there is an autoimmunity, when the immune cells attack those parietal cells. You lose the ability to make stomach acid. If you lose the ability to make stomach acid, this is really severe, can be life-threatening, and that's serious. So yes, H. pylori can be debilitating. Let's talk about H. pylori testing real quick. You can do breath tests. I think it's a urea breath test. You can do upper endoscopy. And in upper endoscopy, they will do biopsy. So they will look at the stomach lining, snap a sample, and evaluate it for H. pylori presence. Then you can do stool test, and you can do a blood test for antibodies. None of these tests are, perfect. And historically, I had situations when one test was done and was false negative. Another kind of test was added and that was positive. And then, you had a better picture. So it just depends. Depends on your presentation and your symptoms, how much you think it may actually be H. pylori based on our conversation even. And then, if you feel like it may be false negative, pursue more testing. I find that with a biopsy, H. pylori can be missed because it lives in patches. So it depends where they culture that tissue, or where they grab that tissue for biopsy. It could be missed. And stool tests differ. GI map is really good about doing the H. pylori panel. So this is the stool test I really enjoyed working with when I had my one-on-one practice. Let me see here what else. Okay, one more story I want to share is the connection between the stomach acid and H. pylori. So H. pylori thrives in the acidic environment. It creates a cocoon around itself. It's like a sausage with a few little tails, and it's like a corkscrew. It screws itself into the stomach lining and creates an ammonia buffer around itself, which is alkaline, so it can live in it. When the environment is too alkaline, well, it's complicated. Let me just scratch that. When you follow H. pylori protocol, you don't want to supplement hydrochloric acid. To keep it simple, just remember that you have to stop doing that. You have to eradicate the H. pylori and then evaluate stomach acid. If it's weak, then you supplement, work with your practitioner. One interesting connection is rosacea. Let me read a little bit about rosacea for you. This is really fascinating. That's one of the most manifestation of a low stomach acid, actually. And interestingly, it's implicated in H. pylori. Here you go. H. pylori infection in the stomach has been found in patients with rosacea. In a pilot study, H. pylori was found in 46 out of 94 patients with rosacea, 38 out of 88 patients with other inflammatory diseases, and 5 out of 14 patients with an inflammatory disease. I think without an inflammatory disease. They also quoted an Irish study, in that particular study, that found 19 out of 20 patients with acne rosacea tested positive for H. pylori. So they're not sure how that works, but there's interesting studies on that. Okay, conventional treatment and then more natural treatment is what we're going to talk about next. Conventional treatment, at least 20% of medication-based treatment for H. pylori fails. Basically, a physician will put you on 2, 3, or 4 antibiotics at the same time, and often PPIs at the same time to block the stomach acid. And that's really not very effective. H. pylori is a genius in terms of hiding, buffering itself, being resistant to medications. And also the biggest issue that medical doctors don't consider is that it has a very strong biofilm, and the biofilm protects the bacterium from those medications. So if you don't use any biofilm, that's also setting you up for failure. So the natural, and anecdotally, there's a lot of people that have tried the medication route, and sometimes if you eradicate it, it comes back as well. So you do have to address other issues and prevent it from coming. The natural approach to H. pylori, there's a lot of studies. So I have developed over the years an H. pylori protocol that have worked, I would say, like 99% of the time, which is a huge success rate. And it is based on the natural approach, and it is based on science. And I'm going to list the ingredients of this recipe. But in terms of dosages, you have to work with your practitioners. This is what I customize and strategize with each individual person I work with one-on-one. So mastic gum is crucial, and it has to be high therapeutic dose. So that is the single most important ingredient of that recipe. And it's going to be much harder without it. N-acetylcysteine is fabulous for its biofilm disruption. And especially if you are on medication, there's studies saying if you add NAC to the medication protocol, it will be more effective. And I would say there's other biofilm disruptors if NAC doesn't do the job. So there's possibilities. Vitamin C has been shown in studies. Monolaurin, extremely sensitive. The bacterium is extremely sensitive to monolaurin. Aloe vera is also very effective. including resistant strains of H. pylori. There is a particular probiotic strain, Lactobacillus reuteri. It basically helps bind the bacterium, clumps it into little balls, and get it into the stool, and you excrete it. Zinc carnosine helps with the healing of the stomach lining. Licorice, DGL or regular licorice, and also manuka honey in studies. Manuka honey and aloe vera are very effective for H. pylori. These are natural tools. With aloe vera, though, you have to be very careful and make sure that the product you're drinking had the latex removed. And then a couple of ideas of food, what to eat and what not to eat when you're working with H. pylori. Protein powders would be helpful to get the amino acid readily available without the stomach having to work on it and break it down, since we're working, against stomach acid. Vitamin C. Vitamin C foods are extremely beneficial. The lower the antioxidant status of a person, the easier it is for H. pylori. So sweet potato, sweet peppers, watercress, kiwi fruit, strawberries, potatoes, melons, loaded up. Iron-rich food. Please use those. Dark leafy greens, legumes, chia seeds are high. Fresh parsley is a good source of iron. Dried fruit, stinging nettle tea. Also, if you brew it strong enough, you'll get a lot of iron out of that. Carotenoid-rich foods like carrots, sweet potatoes, apricots, and anything green like parsley, watercress, spinach, mangoes, cantaloupes, and soluble fiber, whole grains, legumes, vegetables, fruits, seeds. And what to avoid: you don't want to eat pickled food, dairy, chocolate, refined flours, meat, sugar, saturated fat, and salt. Ulcer healing can be impaired by black pepper and any kind of spicy food. You probably know that already. Overeating, NSAIDs, and steroids, they can damage the stomach lining and lead to ulceration. Instead, focus on whole foods and fresh foods. And alcohol and caffeine will stimulate stomach acid, so absolutely remove them. And the more details are in the blog. We will make sure that there's a link to the blog along with this video. I hope this is helpful. Have that conversation with a doctor, get proper testing, and you can heal from it and be free of H. pylori. And make sure you evaluate for Hashimoto's if you have any problem with thyroid. Thanks so much, and see you on the next training.